Hello, my name is Rebecca, and this video is for anyone working in one of our vaccination stations at our GP-led vaccination clinics in Newcastle. This video is for everybody doing the role of a diluter, a vaccinator, a station administrator, or a station supervisor. Not all parts of this video will be relevant to all of the roles, so please feel free to skip to the relevant section. Finally, we will provide PPE for you on the day, but there are no catering facilities at our sites, so please bring your own food and drink and wrap up warm because sometimes it can be a bit cold. Let's start with the diluter. The diluter stands at the middle of the table and is responsible for accepting vials of vaccine delivered to them. These vials are placed in the plastic lidded box on the table. There is a 2-hour time window in which you have to dilute the vaccine. Lay out 6 syringes, saline and a drawing up needle. Only 1 vial at a time should be removed from the box. Invert the vial 10 times. Take the drawing up needle and syringe and withdraw 1.8 millilitres of saline. Pick the vial back up and insert the saline into the vial and then withdraw 1.8 millilitres of air. Discard the saline needle, invert the vial 10 times again and clean the top. Before starting to use each vial, mark the time and date that the vial was diluted. This is the start time of the 6-hour window that the vial needs to be used in. Be clear to inform the administrator each time a new vial is used. There is a clicker to keep track of each new vial used. Pick up the syringe and blue needle and withdraw 0.3 millilitres of diluted vaccine from the vial. Place this in the kidney dish next to the vaccinator. The vaccinator will pick the syringe up from here. Since the needles cannot be changed or resheathed, this process is to reduce the risk of injury. After 6 syringes have been used and filled, repeat the process with a new vial. Now let's look at the role of the vaccinator. You will be stationed at each end of the table with the diluter in between you. The diluter places a filled syringe into a kidney dish for you to pick up. Remember to take care as they are unsheathed needles. Please check that the name and date of birth of the patient matches the Pinnacle form. You must vaccinate into the patient's deltoid muscle of the upper arm. There is no need to clean the skin of the patient with sterile wipes unless the area is visibly dirty. Some patients on warfarin or other anticoagulants will need to apply firm pressure to the injection site for 2 to 5 minutes following vaccination. The patient can move to the observation area to do this, where they will be helped by the staff there. Please use hand gel after every patient interaction, and remember you must wash your hands with soap and water after every 7th patient. The supervisor will swap into the vaccinator role every 30-40 minutes to allow you to wash your hands. Please make sure you wipe down the chair used by the patient after each vaccination. Now let's explain the role of the vaccination station administrators. The vaccination station administrators will take the Pinnacle vaccination form from the patient and check their name and date of birth. They will then fill in the details of which arm the vaccine was administered to, the name of the vaccinator, the name of the drawer, the time and date, and the batch number if this is not already on the form. Please give the patient a card with the time of their injection and a sticker with the time in 15 minutes, at which point they can leave the building. Then direct them to the observation area. A form runner will take the forms to the IT hub. Finally, let's take a look at the role of the station supervisor. The vaccine supervisor is responsible for the station running safely and smoothly, and that the staff are managing the flow of patients. Every 30 to 40 minutes, you will swap into the vaccinator role to allow them to go and wash their hands. You will also supervise the healthcare assistants and other staff who are manning the observation area, assisting wherever necessary if patients become unwell. So those are the roles of the vaccination station. Don't worry if you've got any questions. There will be people on hand on the day to help you. We're really looking forward to seeing you.